Most of these patients, as we mentioned earlier, they're not easy to diagnose, but sleepiness is so common out there and physicians need to think about it. So what are the important things for the community physicians to really know about narcolepsy and recognizing narcolepsy? Alon, what do you think that they need to do to heighten their awareness of this condition?
That's a really critical question. And I think they need to recognize that narcolepsy actually presents in late childhood, early teenage years. The symptoms may not be very apparent. It's often difficult to differentiate a child who is excessively sleepy from a variety of reasons, and knowing that the disease actually manifests itself in the early teenage years, only to be diagnosed 10 years later, that gap really needs to be narrowed. And I think it's because folks are not asking the right questions and because we don't have easy tests to make the diagnosis. The tests for narcolepsy are extremely difficult, and access is...
The median age of onset is 16 years, and we know that the majority of patients don't get a diagnosis within the first 16 years of life. So this is a big problem in pediatrics, is recognizing this condition.
I think recognizing that children may present differently than adults in terms of their sleepiness, that there can be some behavioral manifestations. People are busy in clinic, so using something like a validated tool like the Upward Sleepiness Scale, or in pediatrics, there's also the Pediatric Daytime Sleepiness Survey. These are helpful instruments that can really tell you you're dealing with someone who has severe sleepiness, and you need to take this more seriously than, say, someone who occasionally has sleepiness. And then I think that's a great tip to use the sleep logs. These are easily available tools. You can quickly make sure you're not missing just a routine sleep disorder like insufficient sleep or delayed sleep phase. And if you're not, I think, referring to someone who knows narcolepsy or is familiar with the workup of it is appropriate, or becoming more knowledgeable yourself about the testing protocols.
What do you feel, Russ? What's important for neurologists and primary care physicians to know if they have patients with narcolepsy, either in treatment or in diagnosis?
First of all, everybody in primary care, and anyone who's practicing primary care, has a narcoleptic in their practice, whether they know it or not. And just based on the numbers alone, and they need to be more proactive with spending more time with that patient that complains of sleepiness, because, as Dr. Avedon said, it's not an easy diagnosis necessarily to make. And also I think this is true with most neurologists, they have a board-certified sleep specialist they can refer to, maybe less so in primary care, not just refer to the sleep laboratory per se, but really find somebody specifically that they know and trust who will spend the time and has that expertise. So they need to have a good relationship with a sleep specialist.
Yeah, what I'd like to tell clinicians is that any patient presenting with excessive daytime sleepiness, they need to include narcolepsy in the differential diagnosis. Even if the patient has sleep apnea, or even if they have some other disorder that may be contributing to it, they need to include it in the differential diagnosis. Otherwise, they're going to miss it. And we know this is a disorder that so commonly gets missed because physicians are sort of swayed by the other conditions that are going on in the patients, and they just miss the fact that they can also have narcolepsy.